So we started using PKB sort of in the height of the pandemic, really, about June 2020, and I've been using it successfully since then. So we're mainly using the messaging and consultation request forms. We've got various different options for the consultation requests, including routine and urgent appointments, a form for pill checks, for blood pressure reviews, and also one for requesting sick notes.
So we use the sick note consultations, we use the messaging service, we use the urgent same-day questionnaire, and we use the routine appointment questionnaire as well.
I use the NHS app in several ways. One is to actually look at results, but also using PKB to communicate with the surgery. Yes, if I want an appointment, but also to communicate messages to the administration team, for which I usually get quite swift replies.
I think it's really quite time-saving for patients and therefore for the reception staff, because they're not having to take calls, and when a phone's ringing you really want to answer it there and then, but when it pings in through PKB or an email, you can do it after you finish the task that you're doing, so it saves time and stops interruptions, which is more efficient. From a GP point of view, the information from the patient is all there in front of you before you start the consultation. Sometimes you can have a look at it and think, I really need to see this patient face to face. So instead of first booking a telephone appointment, you can just get in touch with them and say, please could you come down to see me at such a time? That's really quick and easy to do. And with the sick notes, again, it's really time saving because we can just ping the sick note back to them via email, text or through PKB itself.
So I think it is saving time. I think the main positive for me as a receptionist as well, so because I also do a reception role as well as an admin role, is that patients aren't clogging the lines up. So, when we need to get people through for emergency appointments, we're not discussing more routine-based things. If we take one member of staff off reception, allocate them PKB time, they can respond to the patient quickly, but also it saves a lot of time on the other receptionists who are answering the urgent lines. I think it's great for patients to have access to what they need and to be able to take control of their information as well. One thing I am seeing is patients are happy with the service. We've not really had a lot of complaints, to be honest. For example, when I'm on PKB, I try to get back to people within the hour, so it's a very quick and accessible service for the patient as well. PKB has really helped us communicate with the patients, and like I say, just give them accessibility and the access to their own records. They might be able to access PKB, see a previous consultation or something on there and not need to contact us, so it is saving us time as well.
First of all, you don't have to sit on a phone waiting for a reply, because obviously the surgery is very busy. But also you can communicate what you want to say. You can also ideally communicate who you would like the message to get to. Obviously, if they're not on duty that day, then it's responded to by somebody else. But it's just the speed with which you can get a reply from the admin team.
Yes, yeah, it was pretty easy to do. It's fairly user-friendly, particularly the way we run it, with the requests coming into the email account and the staff then dealing with them. That works really well for us. I don't think anyone's had any major difficulties with it at all. Obviously, there's always been a few little glitches along the way, but they've been sorted out, and PKB and Connected Knots have been really helpful with us doing that.